system, and I've used this, and Sean has probably heard this a million times. We do the whole overview of the system, because if not, it's like putting together that 1,000-piece puzzle and someone takes away the box. And so it doesn't give you any direction on where these pieces lie. So we give you a complete overview. The first thing I tell you is it is a drink from a garden hose. Usually a drink from a fire hose is what we call it when we first show people. But since we do this in brief, drink from a garden hose. The dashboard, we have been with public health for about 18 years. It was developed in public health, with public health, for public health, and we haven't ventured out. We believe that there is just a lot of work to be done, that a lot of help, that public health, as far as keeping track of everything that they do, trying to reduce the anxiety of, the anxiety and stress of collecting data to be able to find out where their performance lies. And so we stayed with public health, and it was Maricopa County, and they had a jurisdiction, or they do have a jurisdiction of between 5 to 6 million in the wintertime. And then it's literally a desert here in Arizona in the summertime. But it was originally designed, and it still is, a comprehensive operational planning and execution system, being able to create an operational plan and monitor it, and then of course check it using this Deming cycle, what we call the plan, do, check, and adjust cycle. We are fully demonstrated by FAB, and one of the biggest reasons is we're able to meet that FAB measure and standard 9.1.1a, and being able to have all levels of your department being involved in the performance, and the external partners as well. And then that gets us down to what we say performance management is. What is performance management? We start with an operational plan, and an operational plan meaning that we have a specific plan with a specific set of objectives and a specific group of people that are doing these objectives, and in a certain time frame. So we have a metric. And then, of course, we're monitoring the plan. And then if we find that we're lagging where we're at in this plan, that the system communicates how you can improve by going right back into that plan and starting that phase all over again. And that's performance improvement. With operational planning, to start a plan, we start with this model, whereas it's a pyramid. At the top of that pyramid would be your organization, the health department. Underneath the health department, you might have, you have several groups that do several different things, provide several services or initiatives, what we call initiatives of the things that you're planning on doing in the future. With that, there are certain goals for each service and initiative, certain objectives to meet those goals, and then, of course, the activities down there at the bottom. And here's where Fred comes in, and he's going to take you live into the system and then actually show you what you guys have in your system as well for training. All right, Fred, are you ready? Get on your mark.
Is my turn already?
Absolutely.
10,000 words are up? Okay.
10,000 words.
Okay, well, thank you, everybody, for joining us. As Andrea said, we're going to try to go through this pretty quickly, but we do want you to understand the overall system and then all of the tools and features that are available to you here. So what we're going to do is walk through a live demonstration. We're actually going to then go through that performance management cycle. We're going to create an operational plan, and we're going to monitor it through its life cycle, and then we're actually even going to that PDCA cycle to see how we can make updates and corrections to the plan. So we created this little demo organization called USA Public Health, and now I'm going to switch over to the system itself here. This is the main menu for the VMSG dashboard, but up at the top here, you'll see these navigation tabs. And if you look closely, these tabs are exactly the pyramid you just saw, flipped on its left side. So you get the organization, the groups, services, initiatives, goals, objectives, and activities down here. So right now I'm going to go to our groups tab, which is, as Andrea mentioned, is our org chart. It's the divisions, the offices, the programs within the health department and how they're structured with each other in here. I'm going to go down to our community health division. So now what we're doing is everything we're working on down the pyramid is within community health. So I'm going to look at the services and initiatives for community health. You can see we have 5 different things that community health provides to the community and to the organization. We're going to talk about the Safe Kids program, and specifically we're going to develop an operational plan for the car seat program within the Safe Kids program. So I'm going to go on down to the goals for the Safe Kids program. We're going to talk about promote and provide child passenger safety, education, and resources to partners in the community at large, and you'll see that the car seat program fits under there. One of the important things to note as we go down the pyramid, we're going to get more and more specific about the information. So the first thing we're going to do is flag everything with a status flag. The traffic light was chosen just because it's intuitive for everybody to understand that, green light is good, everything's okay. Yellow light is caution, potentially something going wrong. Red light is, yeah, something has gone wrong. And then the gold bar that you see indicates successful completion of that piece of the plan in there. The other thing that you'll see down here on every screen is this notes or comments field. What that is an ongoing dialogue about this particular planning element. Now, the VMSG dashboard is a full multi-user system, so everybody in your department will typically have access into the system, so a lot of people will be able to see that. So if I flip that green traffic light to a yellow traffic light, I'll probably put a note in there as to exactly why I did that, so everybody else looking at it can go to the notes instead of calling Fred and saying, hey, why'd you flip the traffic light over here? So you'll be seeing that, and it'll be important as we go down here a little bit farther in the demo. So for this particular goal, we're going to look at the objectives. You can see we have 4 of those. Objectives are, again, more specific. Number 1, objectives are SMART. So they're specific, measurable, attainable, realistic, and time-based or time-bound, depending on your definition. So as an example, by September 30th, we're going to distribute 20 car seats per week to families through these various programs here. So it's very specific as to what we're trying to accomplish at this point. The other thing we're going to do at the objective level is assign somebody as an objective lead. To do that, we just a little down arrow here. I'm going to say show all users to show me everybody in the department here. And I'm going to pick Diane Cox as our objective lead. Now, remember the objective is still a target. It's not a how we're going to do it still, it's a what we're going to do. We're going to distribute 20 car seats a week by the end of September. Diane's job is to get us to that point. She's not necessarily the person going to do all the work, but she's the person who's going to get us to, manage the program to get us to that point in there. Now, to figure out exactly how we're going to do it, we're going to go down to the activity level here. And these activities are the specific steps we're going to take to get to that objective. So as we go down through the activities, we'll go down through the vast amount of information down here at the bottom. So the first activity, we're going to establish a funding stream. So we're going to get money to buy 20 car seats a week. Every activity has got a performance metric. The performance metric just says, how do we know when we've successfully completed the activity? So we're looking for funding. Once we've acquired funding, we've completed that portion of the activity. So it's really usually pretty simple. Every activity also then has a team of people assigned to it. If I click down here, you'll see that again. Now, you'll notice when I open up a selection screen, it typically shows 1 or 2 people. In this case, it's because I'm looking at community health division, the people assigned to community health. So by clicking on this down arrow, I can either pick somebody from a different piece of the organization, or I can just click the little red X and say, show me everybody in the entire organization. So in this case, we're looking at Diane Cox as the team lead, and then we have assigned several people as team members in here. Now, just kind of as an update, the people who are assigned as objective leads or activity leads will get an email on a regular basis to update the specific activities and objectives they've been assigned. Recently, we had some clients who wanted to have more than one activity lead because they wanted to have more than one person receiving this email. So we made a change to where now you can select, and I'll show you when we get into your system, we can make a change. So right now, if I select a different activity lead, you notice it clears the first one. So I can only have one activity lead. There is an option now to have multiple activity leads. So you can assign multiple people to get the email notification and go into what we'll call the quick update system, which we'll show you in a few minutes here. So in this case, we're going to leave Diane as our activity team lead, and we have, again, 4 team members who are working with Diane to get to this point, in this case, getting the funding stream. Now, over here in the right-hand column says FTE, or full-time equivalent. What we're doing over here, and this is an optional column, typically used as you get further down the road, getting your plans entered and things. And this is the ability to quantify the human effort in this particular activity. So in this case, we say that Diane and Mara have each indicated it's about a 0.1 FTE, or about 4 hours a week for each of them to get to this point. Sometimes people will go in and do an estimate at the beginning to kind of try to quantify, how intense is this particular activity going to be. And then over time, maybe they'll go back in and adjust those numbers so you have some real numbers as to how much effort you're putting into that. What we do with that is a couple of things. Number one is we roll it up the pyramid. So down here, you'll see the 0.1 and 0.1 with Diane and Mara roll up to a 0.2 at the activity level. If I look at all of these activities, they roll up to the objective. Down here, you'll see the 0.6 FTE. So we're saying about 3 person days per week, it looks like, to be able to accomplish this particular objective. So you can use that for things like cost-benefit analysis, comparing programs to determine, which is the best use of our limited resources in public health. So it just gives you some more data points to work with here. Every activity, in addition to having a team, has a beginning and ending date. So this is the time frame in which we're going to accomplish this activity. And then we have multiple types of activities. The most common one is a project-based activity. Probably somewhere around 80% of what's in the system are project-based activities. It's the most simple too. The measurement criteria is just percent complete. So you're going to say, we're halfway through, we're 50% complete, or we're all the way done, we're 100% complete, or we haven't started yet, we're 0% complete. So it's just a way to measure as you're moving along. Now, if I have something that I want to measure in a finite quantity, I can hit the little drop down here and select a QM activity. What the QM activity does basically is replace the percent done field with a quantity field. So for instance, number of car seats installed, number of restaurant inspections completed, something along that line. Now that quantity can either then be compared against a target. So I could say my target is 20 car seats a week. I put in 10, so we're 50% of the way there. It'll calculate that for you. Or we can say it's an open quantity, and then I just want to count up the number that we've done in there. So you can have either option with a QM activity. The third type of activity you see, a QA activity, is the most automated, typically the least used because it's special, it's repetitive. So instead of a beginning date and an ending date, it's a beginning date and a frequency. Frequency being weekly, monthly, quarterly, whatever. So it's a repetitive activity, something that you're doing like, installing car seats every week or doing restaurant inspections every month, something along that line. So basically what it does is automatically update the dates as you move forward with the particular activity in there. So that's our first activity, is to be able to establish a funding stream. Next activity is we're going to create a relationship with a local car seat installation company to be able to manage this program for us here. Now down here at the bottom, we have the ability to assign those external partners here. So there's a whole external partner database that you guys manage with obviously all of your external partners. So you have the partner organization over here on the left, and then over here you have the particular contact people within there. Now behind this information that you see is all the information you'd expect with contact information, addresses, names, email, that sort of thing in there. So we've chosen Andrea Schoen at Andrea's Car Seat Installation as our partner for this particular project. If we choose to, we can give Andrea access back into the system so that she can go in and help us keep the information up to date, like how many car seats she installs every week. So then our next activity is to get the word out. So we now have funding. We have somebody to manage the program. That's great. Now we got to get the people to understand we have this great program. And if you fall under a certain income range, have kids obviously, and want to protect your kids, we can get you free car seats here. So we're going to go to our PIO office and have them get the word out, kind of a marketing program. And they're going to go to those specific neighborhoods that would fit the typical income demographic for the program, get the word out so those people will go see Andrea. Andrea will qualify them and install their car seats. And then we get down to kind of the bottom line activity, and that is that Andrea's car seats will install 20 car seats a week. So what we just did in the last 5 minutes is created a good solid operational plan to manage the car seat program. If I take you back to the pyramid, it looks like this. It's under Community Health Division. It's under the Safe Kids program. The goal here is to provide car seats to those who can't afford them. That SMART objective is by September 30th, distribute 20 car seats a week to families, again, through the various programs. And then the activities is what we call the operational portion. That is getting it down to a specific set of steps that once we accomplish those steps, we're going to meet the objective, and then obviously meet the goal and up through the services here. So now we've got a good solid plan. Now let's put that plan into motion here. We're going to take it through the PDCA cycle. So the first thing we did is the P part, the planning part. We now have a good solid plan. So let's put the plan into motion here. Into the do phase, we're executing the plan. So what we're going to do is we're going to go to our funding source and get money for the car seats for Andrea. We're going to go to our PIO office and have them get the word out so people will come to Andrea to get their car seats installed. And what we're going to do in the background is we're going to set up this thing called real-time planning. We're going to talk a lot about this today because it's a very important feature, and it's, as Andrea mentioned, it's a way to reduce the stress of collecting information for everything you're doing in the department. Here's what it does. In this case, we'll probably set it up for maybe a weekly email notification that's fully automated, by the way. Let's say we set it up for Monday morning. It's going to go out to Andrea on a Monday morning, and the email is going to say basically how many car seats did you install last week. There's a link in the email she'll click on, takes her into what we call the quick update system. In the quick update system, she might put in 21 car seats, hit save, and she's done. So we've asked for about a grand total of 1 minute of her time a week to keep this information up to date. So it's very, very efficient. So we're going to do that for 10 or 12 weeks. And, you know, at some point in time, somebody's going to come up to you and say, hey, how's that car seat program working out? We're going to go into the check phase, and we're going to be able to show them very easily here. So this is the activity I've selected of installing 20 car seats a week. If I go down and click on this little chart button, it's going to show me exactly how we're doing. On the blue line are the data points that Andrea's been entering for us every week. The green line here is that target number of 20 that we set. The red line here we call a safety zone or a fallback number. And what that's saying is if I drop below this number, something's gone wrong, I need to be notified. So what happens is every time Andrea enters a value on the blue line, it checks it against the red and the green line and sets the traffic light for you. So if it's down here below the red, it's going to set it to red. If it's in between here, it'll be yellow. And as soon as you get up past the green line, it's green. So it's just by looking at the traffic lights, you get an idea of where am I in this curve here. Now, looking at the actual data points in here, it says it took about, 4 to 5 weeks to ramp up to our target number here. And now we're humming along at about 21, 22 car seats a week. Exactly what we thought would happen. So now, back to the PDCA cycle. That was the check phase. In the adjust phase, we're going to make any corrections if necessary. Well, based on the target or the chart we just saw, I don't think any corrections are necessary. Everything's working perfectly. So we're going to go back through the cycle. Maybe a month from now, we'll go back and hit the check button again, take a look at it. Everything's still working. We continue on. Now, I'm going to go back and switch gears a little bit here. I'm going to select this other activity down here of installing 20 car seats a week. So the first thing we notice is the light is yellow. So based on what we just talked about, we go back over here, our chart button, and we kind of knew that we're sitting in between the red and the green because the light is yellow in here. So what happened is it looks like it took us about the same ramp-up period, but we capped off at about 15 car seats a week, and we never made it to our target number here. So what we know at this point in time is that we're not making our target. What we don't know is why. So let's go figure that out. This is where we go out and look at our activities. So number one, establish a funding stream. Well, we've got that big gold bar there. It says we've done that. We're nailed there. Number two, create a relationship with a local installer. Gold bar, we're done. Number three, PIO office is going to do our marketing. Well, we have a yellow light there. That caution, something's going wrong. That's when we'll go down to the notes field. It says may not be reaching the proper demographic, or the plan is set too high. So either we're not getting to the people who can qualify for the program, or we just, arbitrarily set the plan a little bit too high. So at this point in time, we know our problem is in marketing. So let's walk over to our PIO office with our chart and sit down with them and see if they can help us to understand what's going on. So maybe the first thing they tell us is, well, let me tell you what we've been doing here. We've gone out to those neighborhoods we talked about that fit that financial demographic, and we put up some flyers and some posters out there in the shopping centers and such where people gather. So we're getting the word out that way. We're using social media. So there's a Nextdoor app, which is a social media for neighborhoods. So we've been getting it out with some advertising on there. We've been going to the local newspapers that feed those communities and put some advertising there. So overall, we think we're doing a really good job of getting the word out. We think we've done a good job there. Do you think possibly we just overestimated the target number? Maybe that target number is just a little bit too high here. So in this case, the adjustment would be to the plan. So now you have a plan that you develop based on some kind of projections out here. Now you've gone through the cycle for a while and realized that maybe your projections were a little bit wrong. So let's adjust the plan and move forward instead of waiting till the end of the planning cycle, maybe a year from now, going back and saying, wow, we never made the plan. We're going to make the correction in real time as we go forward. Now, had we gotten a different answer from the PIO office, like, yeah, we know you guys came to us a while back. Unfortunately, we had a lot of staff turnover recently. The good news is we've hired a new guy. His name's Bill. Bill's kind of an expert in this area, so we put him on this project. The bad news is he's only been on it for a week or two, so we need more time to get Bill ramped up. So in this case, the adjustment is going to be to resources. In this case, we're putting Bill on there. We're going to give Bill a little bit more time, and we're going to ramp up to our target number. Then there's a fourth potential scenario, and that is kind of a combination of two and three, which is we're going to maybe adjust the plan down a little bit still, maybe adjust the resources up a little bit more, and kind of meet in there. So let's say we take the plan down to 17. We're going to put Bill in there. We're going to give Bill a little bit more time, and let's bring in an external contractor to help Bill ramp up to marketing in here. So those are the four potential scenarios in the adjust phase. Every plan is going through the cycle all the time. You determine what the cycle time is. You know, it could be monthly, quarterly, weekly, whatever you want it to be. You're going to make the adjustments and move forward. So think of your plans as being alive as you're moving forward. They're not sitting on a shelf waiting for you to go look at them at the end of the planning cycle. They're always in front of you. And that's what that real-time planning piece does for you. Now, we're going to switch gears a little bit and look at some of the tools in performance monitoring here. So the big picture tool here is the dashboard. I'm going to take you there live. I'm going to go back to our groups tab here. In the groups tab, again, we're looking at the different pieces of the organization. Now, everybody who's assigned as a user in the system is assigned to a group. Your WIC people are obviously assigned to WIC. Your community health people are there. Your emergency preparedness people are down at FEP. Typically, your senior management folks are up here at the department level, meaning I want to look at the entire department on one screen if possible. And we do that. So when you log in, you're going to your area of responsibility. And then you got this little traffic light button up here. When I click on that, it's going to do a bunch of calculations, and it's going to show me the status of my area of responsibility when I log in. So what you're going to see on the top left corner up here, first of all, it says USA Public Health Department, meaning I'm looking at the entire department. If I were the WIC director when I logged in, this would say USA Public Health WIC, and everything on the screen would be WIC. WIC people, WIC activities. The top left corner is the big picture, I call it. The traffic light is showing me the number of activities, objectives, or goals with each status. So right now I'm looking at the number of activities in the gold, green, yellow, red. And you'll notice that I can roll over and drill down on anything in there. So I can click on the yellows and I can see all the activities that are in yellow status and maybe make some corrections right there. The other thing I see is the schedule gauge. The schedule gauge is showing me where am I against the assigned timelines that we put into the activities. So every activity had a beginning date, ending date, a percent complete, whether it's finite or calculated. But what we're doing now is adding all those together and determining that we're overall about 38 days behind schedule. It's yellow because we're less than 60 days behind schedule where it turns red. And if we're on schedule, it'll be green. So if you're looking at green or yellow, you're probably fairly good. Most schedules are fiscal year long. So 38 days is, little around 10% behind schedule, not too bad. Now, if I want to drill down a little bit further after I look at this, I can go down to the bottom here. And there's three different views here. The first view is my people. So those folks that I assigned as activity or objective leads show up in this column. So you see we have Diane. The last updated column is showing me the last time this person was in there and updated their information. It's color-coded for 30 days is less than 30 days is green, 30 to 60 is yellow, and over 60 is red. So it allows you to look, if everything's green, that's exactly where you want it to be. Everybody has updated their information. You're looking at pretty real-time information. When you get to yellows and reds, you might want to go in and have a chat with those folks and find out what's keeping them from, keeping the information up to date, maybe help them along a little bit here. The FTE column is that same number we looked at the activity level, but rolled up by person. So we got Diane assigned to a bunch of activities that roll her up to a 1.25 FTE, which is basically saying she's doing the job of 1.25 people. Ideally, you want to keep people down below that 1.0 FTE. So you can click on that. You can maybe reassign some of her activities and drop her down a little bit here. The lagging column is showing me the number of activities behind schedule, and it's color-coded as to how far. The days is the same as the schedule gauge for the individual person. So how far is that person behind or ahead of their given schedule here? Overdue is just that. The ending date has come and gone, and we're not yet 100% complete or gold. And then we have the number of red, yellow, green, and gold. So if you look across one person here, you get a great idea of, are they keeping the information up to date? How loaded are they? And then how are they doing against their assigned plan? Now, I also have the ability not only to look at people, but over here I can select groups, which is going to show me my org chart down here and how each division, office, and program is performing, or my priorities. My priorities are my strategic priorities from my strategic plan. So what you're doing there is comparing all the other plans against your strategic plan to make sure that everything you're doing is supporting your vision for the future, which is typically your strategic plan. Up here in the top right corner says My Priorities. These are individually selectable objectives that you want to keep your eye on. Most often, they're either things that you've been assigned and working on yourself, or they're things that your team is working on and you just want to keep track of them up here. You pick them, and they're individual to your login, so they're attached to your username. Typically, they're things that are red and yellow, and typically they're things that are, again, either yours or your team's, and you just want to keep an eye on. I can roll over and get a lot of data there, or I can click down on it and go right to that particular objective and find out exactly what's going on. This button up here says Start Here. It says make this my home page when I log in. It's really a nice feature because once you get the plans in there and get everything up and running, it's really nice to be able to go in the morning, log in, it'll take you automatically to your dashboard screen. You can get a good snapshot of how your area of responsibility is performing. If everything is green and gold down here and you're sitting in the green or a little bit in the yellow maybe, you move on. Your day's done. Or not your day's done, your morning's done. At this point in time, then, if you see things that need adjusting, you can go right in there. You can make the adjustments or talk to your folks and figure out what's going on with specific areas and then move on. So that's the dashboard screen, really a great tool for everybody to have. Document management. You guys went through the accreditation process a couple years ago, and I'm sure you know how document intensive it is. Most people tell me somewhere between 300 and somewhere over 1,000 documents get submitted up into EFAB for accreditation and potentially reaccreditation as well. And just managing those documents beforehand was why we created this piece. So the documents get attached right to the piece of the plan that they belong to. So we have an accreditation, reaccreditation plan in there, and you can attach the documents right to the measures where you're going to be submitting them up into EFAB over time here. But it allows you to easily manage the documents because you have a lot more information around the documents. You got a description versus just a file name. You've got a notes about the document that says, review section 7 of this document versus, putting in multiple versions of a document with highlight and that sort of thing in there. You can walk them through the traffic light. People like to, say if it's red, it's a brand new document. Maybe it's a template. If it's yellow, it's a draft, and it'll automatically do version control for you on the drafts. And if it's green, it's been signed off and vetted. And if it's gold, it's been submitted up into EFAB. So that's why it was originally designed. A lot of clever people. We have about 225 departments online with the system right now, and there's a lot of people who use it for different things. One of the big things is policy management. So build a little plan to manage your department policies on a fiscal year basis, and you attach the policies right to the activity. Grant management, so you got a bunch of documents you got to manage for grants. Why not just have them all attached right to the plan that you're going to use to manage the grant? So it's all right there. So it's all built in. There's no limitations on number of documents, how big they are, what size they are, anything else. Three-dimensional planning is a way to look across everything in the system for commonalities. So for instance, how are we doing against the essentials of public health? It's a categorization process you'll go through, and you say, okay, these are the 3 pieces of plans that support public health essential number 1. And then you can go back and it's like an index that you're creating. The FAB standards are all in there. So you can go back and say, these are the pieces of the plans that are supporting FAB standard 6.1. The strategic priorities we talked about at the bottom of the dashboard screen, this is how they get associated here. I go in and say, these are all the things that we're doing that support our strategic priority partnering in there. And then the documents, same thing. You can go in and categorize all the documents. So now you can go back and easily find them against a multitude of categories, not only the ones that are in there, the standard public health categories, but you can create your own. So if you've got statewide categories that you want to tag, you can use that. It's very simple to do. In this case, we're saying these are the 3 documents we're going to submit for standard 4.2. So three-dimensional planning is just a big overlay across all the rest of the plans in the system. Lots of reports in the system. Most common report used is the operational plan report, and it looks like this. This is again for the car seat program. It was under Community Health Division, Safe Kids program. You see there's a document attached right to that service. So documents get attached right to the planning element. You got the goals, objectives, activities, the people, the status, the traffic lights, everything on one report. And all the reports are flexible. So you can say, I just want last month's information, or I just want to see down at the goal level. I don't care about objectives and activities for this purpose, things along that line. So lots and lots of reports. In addition to the reports that you generate, you can create publicly accessible web pages very simply. Being able, a couple clicks, you can create a web page that has the status of every division office and program, or the status of every one of your strategic priorities, something along that line. I'm going to show you again the one for the car seat program, since that's what we've been talking about. What you have on each page is what we call an indicator row. So this is the indicator row for the Community Health Division itself. You get the rollovers here that show you the number of activities in each status. So if you notice, this timeline and the pie chart is the same thing as the top left corner of the dashboard screen, obviously, except there's a pie chart instead of a traffic light up there. And the timeline is showing me how we're doing against the schedule. I can go all the way down to the activity level here, and you'll notice the rollover shows me number of car seats installed each week on here, so I can see all that information. No limit to the number of rows you can put on a page, so you can have every activity if you wanted in there. No limit to the number of pages you can create. And basically, it just creates this unique web address. You grab that, you put it on your public web page, you put it on social media, you email it out to the Board of Health members before their meeting, that sort of thing. Real simple to do, and again, there's no limitations on what you can do with this. Accreditation, reaccreditation project plan. I think we put the reaccreditation plan into your system, since you guys are probably starting on the reaccreditation process as we speak here. But let me kind of walk you through it and give you the idea of what you can do with this plan. So I'm going to go back to my groups tab again. Down here, you'll see the accreditation plan. There's a version that is just reaccreditation, takes out all the accreditation standards in here. But if I walk down through the pyramid of the plan, first thing you'll see are the 7 steps of accreditation. And I'm assuming you guys are right in here right now in the annual reporting cycle here, moving into the reaccreditation cycle. The other thing you have is each domain, all 12 of them, and then under the domain, obviously, you have the standards and the reaccreditation measures. Under there, you have the actual reaccreditation measures themselves, and these are obviously what you're trying to meet going into reaccreditation. And the other thing that is really cool is you go down to the activity level. So this is still an objective if you think about the reaccreditation measure. The activities are the things that you have to do to be able to get to that particular measure in there. So you'll see down here we have 4 activities to get us to the first measure in there. Every activity, especially in reaccreditation, requires a narrative of some sort or a set of documents in there. So down here it says, describe the ongoing community collaborative process for continuous enhancement of the CHA. Okay, so you're going to have some document you attach. Well, right here is document management. I just click on that. It says I have these documents attached. The one thing you notice, it said 4 documents, you only see 3. It's because you'll notice this one is version 2 of a document. If I click on show all versions, then it shows me version 1 and 2. So the version control is all built into there. But what you're doing now is attaching those documents that you're going to submit for reaccreditation measure 1.1. So what we typically suggest is you let us work with you to assign your domain leads. And at this point in time, it's probably a great time, if you haven't already, to get those domain leads assigned, the people who are going to take you through that domain for reaccreditation. We assign it and we push it all the way down to the activity level for you. So it's just an easy tool that we have to be able to do that. The other thing you're going to do is assign the dates. So you're going to say, okay, this is the date that we're going to submit all the documentation, whatever that happens to be out there. As soon as you do that, it becomes part of the real-time planning process. So now you can use the plan to help you to manage your entire reaccreditation process, and it distributes it out to everybody who's actually working on the process itself at every level in the organization. So that's the accreditation, reaccreditation plan. Now, if you choose to, if you're using the plan, you can use the virtual mock site visit feature. What it allows you to do is hire somebody to come in, typically one of the FAB site visitors who will come in, and they come in remotely. They don't have to fly in and pay hotel and all that kind of stuff. They can come in remotely. We do the training for them, show them how to go through, and they'll grade all of your reaccreditation measures, your documents and everything else. As soon as they're done, you have a report in the system that shows everything that you need to do to get ready for your final site visit here, which I believe is still another virtual site visit by FAB. But this is kind of a pre-site visit to allow you to do that last step of preparation in there. Again, it's all built in. Training, help, and information. The one thing that I do tell people is that help is always one click away. Exactly. So I'm at the services screen right here, and I want to have a little bit more information about services. I just go to the little blue eye up here. It took me to help and information, and it took me immediately to adding and managing services. So I'm right there. It's going to show me every button and every field on the screen if I like it that way. There's a little training video down here. It's 3 to 4 minutes long, and it's somebody actually doing what you're trying to do on that screen. In addition to every feature and function laid out here, there's a training curriculum that folks can go through up here, starting with user level training all the way down through what we call the occasional user training, those folks responding to the emails. But they're all the training modules laid together. And again, they're 3 to 4 minute long training modules. We do recommend that everybody go through at least the user level training. Those of you who are going to be administrators, go through the admin level training, talks about adding users and that sort of thing in there. All built in there, accessible 24/7. Intelligent real-time planning. I want to go over this in a little bit more detail because this is kind of the core of the real-time planning piece. So here's how it works. Typically, after you get everything in there, you're going to set this back to about once a month. Most often, you can set anything you want. It can be anywhere from every day to once a month. So let's say you're going to set it for the first Wednesday of the month. What happens on that first Wednesday at 1 in the morning, the system's going to go in and look at every one of your users and ask 3 questions. Number 1, have you been in the last 30 days and updated your stuff? Number 2, do you have anything behind schedule? Number 3, do you have anything overdue? If any of those is true, out go the emails. Again, you can go to internal folks as well as selected external partners. In the emails, a link. That link takes them into what we call a quick update screen. Quick update screen is just simple, simple, simple. That's all we want to do is make it so easy that people couldn't not use the screen here. And basically, there's 3 fields on there. You can cycle through the traffic lights, so you can set it wherever you want. You can put in the data value, so number of car seats or whatever, and you can put in a note if you need to. You hit the little green button down here, it cycles you right on through. It's going to take you right through to the next, the next, the next. So if you got 5 activities in there, you're going to cycle through those, and then you log out, you're done. This whole process, literally, on average, takes between 3 and 5 minutes per person per month. So if you got them set up once a month, you're only asking the people to contribute 3 to 5 minutes to keep their particular activities up to date. And this is how we keep all the information alive in the system here. This is the core of it here. I'm going to walk you through the process for those of you who haven't been in already, just to take a look at how to log into the system, how to change your password, and how to use the quick update, because that's what most of you will be using most of the time here. So the email looks like this. Here's those 3 criteria we talked about, last 30 days, lagging, and overdue. For all the activities you've been assigned, here's the status. Your system administrators will be set up so that they show up on here as the name, email address, and phone number for the folks that are going to be answering any questions you have about this. And as we mentioned, there's a link that you click on down there. You click on that link, it takes you right into the login screen, and I'm going to walk you through, sorry about that. I'm going to actually walk you through this process now real quickly. So I'm going to log out. When you click on that link, it's going to take you to this screen. You're going to, first thing to do, if you don't have your user ID and password already, is I'm going to hit the send button saying, send me my user ID and password. I'm going to put in my email address. And I'm going to hit send again. This little window is going to come up and say success, meaning that it found my email address, my user ID and password, and it just emailed them to me. So now I have that email. I'm going to go back in here and hit the login button or click the link on the email again, either one. Hit the login button. And I'm going to go in and put in my email or you can either, by the way, put in either your email address or your username that's in the email, your password. And I can assure you the password is not something you want to try to remember because it's some crazy cryptic string that gets put in there. So the first thing you're going to want to do is go in and change your password. You can either go to you're going to hit login. You're going to get this option box. If you've been assigned as an objective or an activity lead, you get the option to go to what we call the quick update screen or just go to the main menu on the system. In this case, either way, you can go in and change your password, but we're going to go straight to quick update. And it's going to go in and look at all of my activities. and give me a blank screen. Yay. There we go. Okay. Recently, it was interesting because we added the capability of having quick update only users, so they can't get to the main menu. And we hadn't really thought about the idea of, well, how do they change their password? So our folks in North Carolina who use it in every health department across the state said, how do we do that? So we added the little key up here to allow you to change your password from this screen. So once you come into the system, you get to your quick update, you click on the little key, they want to put in the current password that you just got from the email. So just copy and paste it in there. Put in whatever new password you want, verify new password like every other website in the world, hit update, and now you've saved your password. So now you're in the quick update screen because you've been assigned as an activity or an objective lead. It says right up here, this is my pyramid. So my group, service, goal, objective. Underneath that is my activity. Right now it says I'm on 1 of 5. So I've been assigned 5 activities that I'm responsible for. Down at the bottom are those fields we talked about that I can change. I can click through the traffic lights. I can put in a data value, and I can put in a note. I hit the little green button down here. You'll see it takes me to 2 of 5, so it's on my second activity. I'm going to go all the way through my activities. And a lot of times, by the way, you're going to look at them and say, nothing's changed. Just click on the button and go to the next one. Or you might even put a note in there that says nothing has changed and go to the next one. So I'm on 4 of 5. Now I'm on 5 of 5. So I'm on my last activity. Do my update. I'm going to click the button again. Now, if I've been assigned as an objective lead as well, I'm going to get this screen. It says go to my objectives. So I'm going to go to my objective screen. It's going to be very similar, except obviously up here. Same thing. I can go through the traffic light, put in a data value, and put in a note if I need to. I'm going to cycle through my objectives, 2 of 5, all the way through. When I'm done, I log out, and I'm done for the day, basically. So this is that process we've been talking about. This is where you need to get your people to be involved. And what we found out is after we developed this, by the way, it wasn't like this to start with. It was taking people, half hour, 45 minutes to do their updates because they're having to go navigate through the dashboard. So we built this specifically for the reason to make it as efficient as possible to keep the information up to date here. And what we found is happening is you're going to send this out to folks. They're going to look at that and say, sure, it's only going to take me 3 to 5 minutes. And they're going to go through it. They're going to look at their watch and say, wow, it only took me 4 minutes. I'm okay with doing that every month. So they'll get the email every month and they'll do it. And then you get the reminder on the dashboard screen that shows them, that they need to be doing that for you every month here. So we'll skip this part for now. Okay, so that was the basic overview of the system and a quick update. Before we go into looking at your strategic plan, are there any questions?
Fred, this is Sean. The real-time planning part, I think there's a mention in there, and I want to say maybe it was under the quality assurance part, but for instance, the number of car seats, let's say you need to check on it on a weekly basis and then have that be a reminder for them to do that. Is there a way to do that per that activity or the objective versus, talking about monthly? Because then all the updates will come up on a monthly basis versus just zoning in on a particular activity or an update.
Yeah, right. It's going to be set up on whatever time frame. It's going to be 1, 2, 3, 4, however many times a month you want. So that is a kind of a limitation if you're doing a weekly update. However, if when you're setting it up, if you turn off the monthly 30-day monthly cycle and set it for weekly. Well, let me take you in there and show you actually. I'm going to log out of here and log back in so I can get into your dashboard here. Okay, let's go find you guys. There you are. Okay. Okay, so under settings, or the main menu, settings, and then notifications. So right now you got it set up for the last day of the month is what you have set up. And it's going out for all 3 reasons. I haven't been in 30 days, lagging, and overdue. Now, if you wanted to have a weekly update, let's say on a Monday morning, you could set this for every week on Monday. And then what you do is undo that one there. So now what it's going to do is it's going to send out the email, but if you've kept your information up to date, so you're doing it monthly, you kept it up to date, you're not going to get a notification because it's not flagging you for that monthly update. So that kind of helps you to let the information in the activities drive the updates. Does that make sense?
It does. I guess if you set it that way, will it ding everybody though who's in the system to do a weekly update?
Only if they're behind schedule or overdue. So yes, it would.
Okay.
If everybody is not keeping their information up to date, it'll ding them every week in this case.
Or lagging or overdue. Okay. All right. I was just trying to think of tying like a specific activity, account for if we needed a weekly or every weekly basis. Yeah. But
what you're going to find, Sean, over time is monthly is going to be plenty of information for you because you got so many people who are going to be contributing to that you typically would find that monthly is a good cycle. But again, you can do it any way you want.
Okay. And then I think you did a great example of the community health division, and they have multiple programs.
Uh-huh.
Are we able to, how we can assign, I think by groups of what certain staff members can see as far as plans?
Yes. Yes.
Can you do it by the service or program? So let's say you're under that division or that a branch as we have, but only a senior manager only wants their tobacco program plan to be seen by that only that plan versus all the other plans that are related under that community health group.
Right. Here's the way you can do that. What you do is set up subgroups because it is at the group levels where the permissions are. So what you'll do is under community health, where you have community health as the group, you can put on level, like under here we have WIC as a level 3 group under community health. You could put each of the programs as a subgroup under community health, put the program in there, and then you have control at the user level to be able to say which programs they have access to.
Okay.
So yeah, you can't do it at the service level, but you can kind of trick it, if you will, by saying, okay, each service is a subgroup, or you could just have maybe there's just one or more services that you want to limit to specific people. You can just break those out into a subgroup by themselves and then have everybody else in the other subgroup.
Okay. And then the update part, when they do come up monthly, it'll be all the updates they're tied to. If you did an update, let's say a week ago, and you went in the system, that same update you did will be part of that big group of updates that you're tied to when the monthly reminder comes up.
Exactly. It's if you've been assigned as an objective lead or an activity lead, then you're going to get the updates.
Okay, so just if no updates to that, just arrow through it, then you'll still see it.
Yeah, right. Yeah, you'll go through them and you'll look at them and say, no, this is still good. There's some things that that only change quarterly or even annually. So you're just going to look at them and then cycle through them, and it takes you another second to click the arrow to go through them. But it gives you the opportunity to look at them, maybe even put a note in there that says, nothing has changed, or whatever you want to do, just to make sure the data is always fresh.
Okay. Do you know best practices for the notes comment section? So we see the prior notes there, and it's like bundled up essentially for the reports. Should we delete the prior notes as we put in a new one? Because it looks like it pre-populates the section.
Now, what I would do, what most people do, is just keep the notes in there and just put either, if you want to put them ahead of this note or behind this note, however you want to do them chronologically. Some people put in, the date and the person in there, like my name and the date that I put this note in there, and just keep a chronological record in there. I think, most people keep all the notes in there, but there's going to be some point in time where they don't make sense anymore, like if you go from fiscal year to fiscal year or something like that.
Okay, and then you can remove that way. Because ultimately they're all time stamped, I think, in there, right?
Right, yeah, everything is stamped in the history file here.
there. Yep.
So yeah, it shows you the notes and exactly when it was done, who did it, all that stuff.
Okay.
Make sense?
Brad, I have a question about the
Yes.
personal dashboard. So when you showed a activity leader summary in the personal dashboard, which had quite a few more fields. Ours right now that I'm aware of is set to objective leader summary. Does that have to be a preference set by the organization, or is that per person?
No, I'll show you. Let me get back to here. I'll go back to the dashboard. You pick, there's those buttons on the left side. You pick what you want to see.
Okay.
So right now,
Oh, I see it right there. I'm sorry. Never mind. Thank you.
Yeah, no, you can look at the goal, objective, or activity level. Any other questions?
I was just curious, is there a specific report location for the three-dimensional planning area?
Yes. Yeah, it's called the category tag report. Show you right here. This guy right here, category tag report. So it's going to allow me to select the categories that I want to see that have been tagged. And I can look at what level. I can look at documents, abstracts, services, goals, objectives, or activities. And I can go and say, you know, everything that's been tagged for this strategic priority and public health essential number 1. So here's the logic behind it, by the way. Within a category, so you got categories and subcategories. Within a category, it's an OR function. So if I say I want to see everything that is either strategic priority 1 or strategic priority 3. So it's going to show me a superset, if you will. Between categories, it's an AND function. So what I can say here is if I take off that one, what I'm saying now is everything that is strategic priority 1 and is marked as public health essential number 1 will show up on the list. So it's going to be a subset. Is that making sense? So it's a Boolean logic thing.
Okay. And then it'll pull all that up in the report, whatever essentially we're selecting that we need to see.
Exactly. However you select it, then it's going to just show it's going to show you, here's what you selected, here's the categories and subcategories, and then it's going to show you everything that meets those categories and subcategories and at what level you want to look at.
Okay, where it's tied at. All right. So like the domains, actually all those areas we can add more categories, correct? And change the subcategory.
Yeah, and sometimes a lot of these categories don't make sense to you. They're kind of standard categories, but if you wanted to change those around, get rid of some of these, you can delete them. And I'll show you right here. Oops. From as an administrator, from the main menu, here's your categories. So you just go in here and you can, add a category, delete a category. Over here, you add the subcategory. So if I select managing for results and I might want to change and add different things in here, I can do that. So just same as you do anything else. Plus is adding it, X is deleting it, and save.
Okay. And if you could remind me, under the quick updates, that's another location like staff could also tag essentially from that area as well, but they only have access there. They should be able to still tag.
From quick update, you don't tag things now. It's all you can do is respond on quick update.
Okay, so we would need to do that.
Yeah, you gotta categorize things in the main dashboard, and then it'll show up in. Well, it really doesn't have an effect on a quick update, I don't think.
Okay.
What else? So it sounds like, Sean, you've already been into the user screen and the group links and all that kind of stuff. You're pretty comfortable with that?
Yeah, for the most part. Oh, that was another area. So the partners list. We can start building a list, if I'm correct, and with the information that is separate from actually having a partner involved in a plan.
Yes. Yeah, the partners are more of defining the linkage without giving that partner access. In order to have a partner having access to the system to quick update or whatever, you got to make them a user in the system. So they are kind of separated.
Okay.
Now,
So this would, so that,
go ahead.
oh, go ahead.
I was going to say kind of a trick on the partner screen. Once you add a partner in here, anybody who's a normal user, manager user, or an org admin can add a partner and manage the partners in here. However, only the org admins have, and by the way, org admins and managers have access to activating a partner. So what you do is once the partner's in there, you're going to go in and take a look at it, just make sure there's not duplicates, it's clean, the information's clean, then you're going to activate it. You can activate the partner and the partner contacts. Over here, you see there's another button. So up here, I have Andrea's car seat, and down here, I say it's active. What happens is when you activate it, then it shows up in that partners list to select at the activity level. When it's inactive, it doesn't show up in that list. It's just it's a kind of a duplicate checking thing. It was actually real story. It was brought about because we were working with Arizona Department of Health Services, ADHS, but their website is AZDHS. And somebody went in and put in a whole string of ADHS and a whole string of AZDHS. So we had to go back in and make sure that it wasn't duplicated. So that's why we put that in there. And by the way, you can turn off that activation feature and just let everybody activate their own partners right off the settings screen. There's a little on-off thing in there. Did that answer your question?
There's times well, sort of. So there's times for when we're providing evidence for accreditation of partners, community partners engagement in certain plans, and this would help define that.
Yep.
I mean,
absolutely.
help demonstrate that. Excuse me.
Yeah, because you're attaching those partners to the activities that they're involved with. Those activities can be tied to the reaccreditation measures in your case. So you've got all that tied together.
Okay. Thank you.
Sean, was there any questions on the user screen? It's one of the things we typically go through here is, what things on here do you need? Do you understand the different user types?
What's the difference between the manager and user? Is a user allowed to do plans or input or?
Yes. Well, there's two differences, three differences. The manager, okay, user can only delete from the objective level down. So they can, remember, if you delete a goal or a group, you're deleting every service, every goal, every objective, every activity underneath that. So you could do a lot of, damage, for lack of a better term. So normal users only get to delete the objective and the activity. So if I delete an objective, it's going to delete the objective and the related activities. A manager user can delete from the service level on down. So they can delete more. Secondarily, there's a function to be able to hide services. So I go back to my, just do this one here. My services, there's the, services. I have the ability, like this one you see is hidden down here, the little button down here. A manager user can see the hidden services. A normal user can't see the hidden services. So what that allows a manager user to do is look at the hidden stuff, which is typically archived from last year or the year before or whatever. So now as a manager, I can do a report year over year. As a normal user, I can only see current information. So that's the real difference. And the third difference is that a manager user can activate partners in addition to the org admin user, whereas a normal user can't do that. So the manager user and the regular user are pretty much identical with the exception of, the capability of deleting higher up the pyramid and seeing hidden activities or hidden services.
Okay, makes sense. And then when they're hidden, they will not come up in the overall operational plan report.
Correct.
Okay.
Well, in a report, it's if you're a manager or an org admin, and you do a report, it's going to give you an option. Do you want to include hidden services in there? But if you're a normal user, no, it won't show up at all. But if you're a manager, because sometimes you might want to look at year over year stuff. So you might have services under, like we have here, we have 2018, 2019, and 2020. So you might want to say, I want to include 2019 to 2020 in this report so I can see how we did year over year, something like that.
Right, if we are doing some kind of year-over-year planning, is there a way to kind of copy forward a plan?
Absolutely.
And then
Right.
adjust
Yep. So let's say I want to take 2019 here, and I want to make a 2020, which I already did here, but I want to make a 2021 version. I just use the copy button. Let me go ahead and hide that for now. So I'm going to take 2019. I'm going to make a 2021 plan. This is the copy button, the little 2 pieces of paper. So I copied that, and notice the little paste button lights up. I'm going to hit that, and I'm going to say, do you want to copy the flags, or do you want to set them to red or green? I'm just going to say copy them for now. And boom, there's my 2020. It shows you it's a copy by putting that in there. Take that off there and make that 2021 and save that. So what I've done now is made an entire copy of the 2018 pyramid all the way down. At this point in time, then you go in and make your corrections to the dates, obviously, and maybe some of the people that are involved and that sort of thing. But it's easier than creating a whole new plan or, having to re-enter the plan. It just starts you at the beginning of copying the plan and then moving your way through to make the corrections.
Thank you very much.
Yeah. We'll hide that one now. What else?
I was just curious if you have any new updates coming around the corner. I know, like the leads we were excited about to have duplicate.
Yeah, the duplicate leads was the latest one. Trying to think if there's anything. Yeah, right now we're working on, there's a couple little, you may have seen, occasionally you'll see a little window that pops up that says you can't do this because XYZ is editing it or something like that. Have you ever seen those?
Yeah. Yes.
Yeah, that's an annoying little thing, and we're trying to run that down, and I'm having trouble duplicating it is the problem. I can't make it happen when I want to make it happen, so it's very difficult. So we're scanning through the code to figure out what could possibly cause that, and it's just a pain. So that's taken up a lot of the development time right now. But yeah, nothing big on the future. You got any ideas on things that you'd like to see in there?
I know we kind of talk about little things here and there, but I'll keep taking notes. I know one of them was like the spell checker. I know it lets us know that there's something misspelled, perhaps, but right click.
And unfortunately, at this point, that's what it is. The core development tool behind here doesn't allow you to right click in data fields, and that's the problem. So, I'll keep my eye out to see if there's a better spell checker add-in for the browser than that. But right now, it shows you got a spelling error, but it doesn't allow you to right click and correct it, unfortunately.
Yeah. Okay. Yeah, I think other than that, I think we're pretty good.
Okay, well, you guys have gone in, since we last talked and basically put in your entire strategic plan, which I think is great. I was going in looking, saying, okay, we'll talk about this, but you guys are pretty much done with that. Let me go in and look at that here. So under your strategic plan, and I've actually copied it out right here. So yeah, you guys have pretty much gone in, and I think you got it all in there already. So your strategic plan is set up and ready to go. You got people assigned to it. So all of these folks are going to be getting the email notifications. Do you want to go into any of that? Or, you guys have already obviously been in there and done it, so you understand that process. Is there anything you had questions on as you were putting the plan in?
I don't think so. Nothing's ringing a bell at the moment.
Okay. Well, the next thing might be, start going through the rest of the FAB 6-pack of plans, your QI plan, your workforce development, that sort of thing. Right now we got the QI placeholder in there. We can always put in your workforce development, your emergency operations, chip and chaw in there as well. And, start building those plans out as you're getting ready for the reaccreditation process.
Yeah, that's definitely a topic of conversation here.
And by the way, if you get the plans in a draft form where you've got the structure laid out, and I would ideally imitate the structure of the dashboard as you're building the plans. It makes it a whole lot easier, right? Or build the plans in the dashboard if you haven't built them yet. Why take a piece of paper and, you know, put it on a piece of paper when you can build it right into the planning system and then dump off a report and you've got the whole thing on a piece of paper if you want it that way. And you get all the formatting right and everything that way.
Yep, very true.
And if you have any drafts or anything and you want me to help structure them in, just send them my way. I'm happy to do that for you.
I think in both of those two plans, both our QR plan and our workforce development plan, we have to kind of figure out what's going in the actual plan versus what's going in our team plans.
Right.
Sean, does that make sense?
Yeah, like if we have a quality improvement plan specific area versus the actual work plan itself, the overall.
Right. I mean, our team work plans are one thing, but you know, when we look at communication plans or quality improvement plans, I don't consider them necessarily work plans the way that we currently write them.
Those bigger plans, yeah.
Right. And so that's why I'm like, if what, you know, should the quality PMQIC and workforce development team plans actually be the part of the six-pack, or are we actually using our documents as the plans? And in that case, there's not a whole lot in them that we need to move over. So just things for us to think about.
Yeah.
Typically, what you have in here is a work plan, and it becomes a subset of the final plan because, for lack of a better term, there's a lot of fluff in the big plans. You know, who did it, what's the process we went through, you know, everything that you're going to put around it. Then you get down to the work plan at the end. So what you can do is you can export the work plan here to a Word document and incorporate it right in with your plan so that you always can have an updated version of it in there.
So I guess this does bring me to one of those questions. If does the copy feature work between services and initiatives? So for example, we have a pretty robust workforce development team plan right now. And if we decide that we're actually going to use that as our workforce development plan, how do I get it from one group into another group and without having to retype every component?
Yeah, exactly. So let's just say for kicks, in my strategic plan, I have quality. I can copy that here, say now it's quality and it's in the buffer. I can go back over to the other QI and I can go under here and I can paste it right in there. That's going to take a duplicate of that whole plan and put it right into your QI group.
That's fantastic. Good to know it's that easy.
Is that what you're asking?
That's exactly right. Because yeah, I'm like, if I don't want to retype it all if we decide to make this transition. And so I'd rather just, you know, copy and paste it and then delete the old one, you know, and work from the new one in the correct place.
That's exactly what it's there for. And yeah, there is no cut and paste, by the way. So it's a three-step process. It's copy, paste, and then go back and delete if you want to.
Perfect. Thank you.
Now, the other thing I would suggest is before you go back and delete, hide it. So just hide it for a while. It'll be out of harm's way, kind of, you know, but it's still there in case you want to go back and refer to it or something. Just as, you know, you're
sure.
Keeping it in there so you can go refer to it, but it's out of everybody's line of sight.
That makes sense.
Okay. What else? What else can I show you? What other toys?
I keep thinking I don't have any more questions, and then something comes up.
Same for me.
Well, you guys have got my contact information, so please don't feel like strangers. Don't feel bad to reach out to me at any point in time. You know, you text me. You should all have my cell phone number. You text me, email me, call me, whatever you need. I can pop open a go-to-meeting in a few minutes here, and you know we can dig into anything that you've got. So don't be afraid to do that.
Thanks so much, Fred.
Okay. Well, if there's nothing else, I'm going to let you guys get on with your day. And if you have any questions or you need any help on anything, please reach out. I would love to see you guys get the rest of the six-pack of plans at least structured in the system so that you got all the people assigned and you start using the real-time planning piece as you move towards the reaccreditation. Let me check real quick here to make sure that we got the reaccreditation plan in here for you. Yep, right there. Yeah, there's your family
started getting needs going on that too.
Yep. Yep. And again, if you want me to push down the people and the dates for the reaccreditation plan, I've got a tool that allows me to mass assign that, so you don't have to go back and assign 100 activities to people.
Is that tool the only thing we have the leads pretty good and I have those set up, but is there, based off when our reaccreditation date is, which is in 2021, does it assign the activities or objectives based on that time frame? Best recommendations?
What it's going to do is
everything
you're going to give me the beginning and ending date for the activities at each domain. I can do it all at once, or I can separate them by domain, and you're going to have to pick what those dates are, the finite dates. I can't say that it's going to be 6 months ahead of your reaccreditation or whatever, but just if you give me the dates and the people, and it's usually a beginning point. So for instance, let's say you assign domain 1 to yourself, Sean, and you're going to push you all the way down to the activity level. You're typically going to go down there and say, okay, I'm going to reassign these activities to somebody else on the team. So it's a starting point. It's kind of like copying and pasting the service. It's a beginning point, and it allows you to go in and very easily make the corrections without having to retype and things.
Okay. And we,
oh,
go ahead.
Go ahead.
I was just saying, I have the leads in there, and most of the dates for all the narratives and documents, I essentially set for December 2020 prior, so we have time for like a mock survey, because it would be summer, fall of the following year for submission.
Okay. Awesome. Yeah, see, that's awesome. Yes. So poor Bethany's going to get a lot of emails. Say, that's good.
Yeah. Yeah, because even down to the objectives. And then, oh, that was the other thing. They, as the lead there, she have to be a certain level. Who can change, like, can a user change a lead?
Yes.
Okay, so they can move around and change the leads, but like just a day-to-day user, they wouldn't be able to?
Yeah, any normal user can change the lead if you've given them group access permissions. So they're at the objective and activity level. They can assign the people in there, because typically they're the person who's responsible for managing that particular activity or that objective.
And essentially, if somebody has an assigned, if they're allowed access in a certain plan, that automatically gives them the ability to drill down to an activity, and they could do an update for somebody. Yes. If they're not identified as a lead.
Right. Yeah. Anybody who's a user who's given access to that piece of the plan can go in and make an update, and it'll tag it in the history file as to who did what when.
Okay. Okay. Very good. All right. Well, I know I have a couple more set up with you later this week, and then next week with the other users.
And if you have any feedback, Sean, on what you'd like to tweak on the next trainings, just let me know. But we're planning right now is we'll kind of go through the same thing, I think.
Okay. Yeah,
okay.
Well,
you guys
good.
have a wonderful week.
All right. You too. Thank you, Fred. And yeah, appreciate it.
Have a great day.
You.
Bye-bye.
You too.